Good morning, everyone, or good evening, good afternoon, from whichever parts of the world that you are joining us from. Welcome to the GBD Collaborators GBD in Focus event today. Thank you for joining us. My name is Ruri Shalendrawati. I'm a Senior Engagement Officer and your facilitator today. And I would like to extend a very warm welcome to each of you. Thank you so much for joining us today for this session, which is the GBD 2023, a closer look at causes of death. So this is the second topic in our GBD 2023 in Focus series, in which we provide an overview of the GBD 2023 results, followed by a more in-depth look at each of the three capstone publications for this GBD cycle. And as this is an exclusive session for GBD collaborators, I would like to begin by recognizing the contributions of each of you as a collaborator, and hopefully together our collective achievement in publishing GBD 2023. And so thank you so much on behalf of IHME, and we hope to continue working with you on GBD 2025, and work has actually already begun on the next update. So the GBD 2023 is the latest update to the Global Burden of Diseases, Injuries, and Risk Factors study. The GBD, as you all know, is a systematic and scientific approach to understanding health loss due to injuries, illnesses, and risk factors for all ages, sexes, for all locations in the world from 1990 to 2023. And at its very heart, it can help to serve policymakers to understand where and how their country's health systems are working and where there are challenges. So if you haven't signed up yet for any of these upcoming sessions, please go ahead and do so. You can access the registration links on the collaborator portal. And so today we have the honor of having Dr. Mohsen Naghavi as our presenter. And please allow me to tell you a little bit about him, following which I will also share a little bit more about today's proceedings, and then hand over the floor to our special guest for today. So Mohsen Naghavi, Dr. Mohsen Naghavi is a professor of health metric science and director of subnational burden of disease estimation at the Institute for Health Metrics and Evaluation, or IHME, at the University of Washington. In his current role, he leads the Institute's work on subnational analysis of disease burden, working closely with our international collaborators and country governments around the world, including in Brazil, Russia, Iran, China, and Ethiopia. I see a lot of claps here recognizing Dr. Naghavi's important work. He is also a GBD team leader of the Causes of Death, Intermediate Causes and Linkage Data Team, AMR, Antimicrobial Resistance Team, and Skin Diseases Team. Additionally, Dr. Naghavi is a member of the Global Burden of Disease Scientific Council, which helps guide the research of the GBD. Prior to his work at IHME, Dr. Naghavi was a research fellow at the Harvard Initiative for Global Health. He was also a senior expert on primary healthcare, disease, injury, and causes of death in Iran, having spent most of his career at the Ministry of Health and Medical Education, running numerous programs and initiatives, including causes of death registration in Iran. And at the ministry, Dr. Naghavi headed the Applied Research Center for Health. In 2015 and 2016, he was named one of the world's most influential scientific minds by Thomson Reuters. And Dr. Naghavi studied at Tehran University and received an MPH, a PhD in epidemiology, and a medical degree. And so before Dr. Naghavi begins his presentation, I would like to go briefly review our agenda and some housekeeping today. and then following which I will hand over to Dr. Naghavi. In today's session, we will spend approximately 30 minutes looking at the findings, and then we will have a 20-minute question and answer segment where each of you will have the opportunity to pose any questions that you may have. And out of necessity, mics are muted, and so if you would like to ask a question today, please use the Q&A function to do so. You will find it at the bottom of your Zoom screen, and we'll be monitoring those, and we'll be responding to some of them directly and raising others for Dr. Naghavi to answer. And so just a little bit about IHME's research. It encompasses a wide range of global health topics with several key projects driving our work. I will briefly walk you through some of the major projects we are involved in. Of course, the first one is the Global Burden of Disease, which offers a comprehensive view of mortality and disability across countries, age groups, and sexes. It quantifies the health loss from a broad range of diseases, injuries, and risk factors, which hopefully can help improve health systems and reduce disparities globally. We also analyze patterns in global health financing from 1990 to 2050, focusing on development assistance for health, and this includes detailed insights into the sources, channels, and recipients of DAH, or development assistance for health, and how these financial flows have changed over time. We also have local and small area estimation project, which provides highly granular estimates of health outcomes and related measures across large regions and even entire continents, offering detailed data that can inform local planning and local policy. We also have future health scenarios, which forecast the global burden of disease results by examining more than 370 diseases and injuries, along with key risk factors and indicators. These scenarios assist policy makers, researchers, and donors in assessing the potential impacts by providing reference scenario and alternative scenarios. And then lastly, antimicrobial resistance, which Dr. Naghavi also leads. IHME estimates the global impact of bacterial AMR. We analyze deaths and disability adjusted life years attributable to AMR across 23 pathogens and 88 pathogen drug combinations in over 200 countries and territories. So these projects are at the core of our research and significantly contribute to global health knowledge and guiding policies and interventions. So GBD 2023 represents a quite remarkable global scientific effort, and largely thanks to also all of our collaborators to understand the world's health. It brings together data from 1990 through 2023 to quantify the impact of 375 diseases and injuries, along with more than 3,700 related health outcomes across 204 countries and territories, and even at subnational levels in 20 of them. And so this latest cycle also measures 88 risk factors, helping us to see how health is shaped by the environments and behavior around us. And so together, these results tell a powerful story of global progress and ongoing challenges in global health, and all captured in 3 landmark capstones published in the Lancet on October 12th. And with that, I would like to hand over the floor to Dr. Mohsen Naghavi. Dr. Naghavi, the floor is yours. I'll stop sharing.
Let me share my slide. Okay. Good morning, good evening, anywhere that you are in each time. I am very happy to discuss with you about the topic that we have here about the causes of this result and mortality that happened in the 23, and I hope that I can answer your question if I can do that. Okay, let us start with the bad news that it's, let's see that, okay, how people in the world dying. You can see this is the number of the deaths by year in the different year. And you can see usually people compared with the previous year die every year 1%, 2% higher than by the number, higher than last year. For example, 2025, people die by the number 1% more than 2024. But when we look to the age standardized that we compare whole world in the one age level, we will see that no, people die lower than last year, and increasing in every year is due to the increasing age. In other words, risk of the deaths is going down every year compared with the last year. But it was the process until 2019. And after 2019, we have a big rise of the deaths due to the pandemic of the COVID. It's increased in the number 9%, 10%. In the age standardized is 7%. And after that, in 2023, it's decreased compared with the 2022. And we are now in the level of the 2019, based on the a little lower than 2019. But I have to say that I am sorry that I have to say this, but pandemic killed 18 million people in the world. And this is a very bad failure of the human and global level, in the global level, that we lost this big number of the people, and it shows that we have to be ready for the next pandemic, next epidemic. Hopefully it will not happen, but if it want to happen, we have to be ready. This was a big experience for us after Spanish flu in the 1990. And okay, 10 million people, 10 million men, 10.5 million men, and 7.5 women die in this situation in these 3 years. Okay. And we have this number in our paper by the country. We put all of them together for every country that we saw. We can see that from 2020 until 2023, how many people died due to the COVID. And this will be a good information for you. Because in the paper in the 2023, we produced a new concept in the mortality area. I prefer to mostly go through the paper and then go to the GBD compare. Okay, this is the process that we had every year. It is situation in 1990. In 2021, you can see COVID is the top causes of deaths. And then in the 2023, it will go to the top 20, go to the 20 rank. And based on the YLL, it's go to the 2021. But again, do not forget that neonatal deaths based on the YLL is top cause. And ischemic heart disease is at least from 2019 is the top causes. But anyway, we had the big success to decrease diarrhea deaths. And now you can see that diarrhea deaths is in the rank 8. And this is a good progress for the human community in the world, that we did a great job in this area. Okay, but there is something that we have to consider. Comparison changing in the global level, we can see that we try to compare this decreasing between male and female. You can see some causes uh, increased, especially in the male, in the female, that you can see that female deaths in HIV is bigger than male. Urinary infectious and urinary disease is bigger than in female compared with the male, increasing. Chronic kidney disease, again, in female is much bigger than male, and also diabetes and also Alzheimer and dementia and pancreas cancer in male is much, in female is bigger than male, and all of them is increasing compared with the everything that happened in the 2019. And other part of the disease is decreasing. Some of them is more in the male, that is COPD, that is lung cancer, that is fall, that is asthma, and hypertensive heart disease, that in female, in male decreasing is higher than female. This is, we wanted to look to the, in the global level, to the pattern of the mortality, time trend of the mortality by male and female. Maybe this is a good, if you want to write a paper for your country, look to the how is the comparison between male and female time trend. Okay, one other idea that I want to talk more about, that is mean age of the deaths. People with the different disease, in which age die in the world. Look here. This is a little, it's need your attention. This part is a population pyramid based on the age and population. You can see. And this is pyramid of the mortality. That is a very important thing. And you can see that, okay, for example, this is ischemic heart disease. Ischemic heart disease die more in uh, the male and female by the different age group, you can see. And we calculated something that it will be interesting if you want. This is the observe of the mean of the age, and this is, I think that this is Australia. Yes, if this is Western Europe, and people die in the age 78. If we calculate expected, that we explained how we calculate expected, expected was 75. In other words, in Western Europe, people die with the ischemic heart disease 3 years higher than expected. That is very good. We are very happy. And it is in men, this is in women, that women fortunately die 4 years after expected. Uh, okay, now we compare with the South Asia. South Asia is including India, Bangladesh, Pakistan, Nepal. And you can see, unfortunately, men dying in age 66 year. If you look, it is 12 years different. They die sooner than Western Europe with these causes. And 2 years, 1 year lower than expected. And same as these for the women. This is very unfortunate that people in this big country with the big population die in the much lower, much sooner than uh, people uh, in the other country. Maybe many of you say that, okay, this is due to the age structure. Yes, but we calculated, this expected is based on the age structure in the world. And you can see they die 3 years sooner than expected. Okay, it is very bad. Now look to the same this to the Australia. This is Australia, this one. And you can see that they die in the 78, 86, much higher than their uh, expected, fortunately. Unfortunately, when you go to the Eastern Sub-Saharan Africa, that is Ethiopia, Kenya, Sudan, also big part of the population in the Eastern Sub-Saharan Africa, you can see it is very bad. 66, they die. Mean age of the deaths in the Eastern Sub-Saharan Africa due to the ischemic heart disease is 66. And it is almost 20 years lower than Australia. It is very unfortunate that needs a global intervention for the fixing the problem of the non-communicable disease and communicable disease. And this is lung cancer. You can see that again there is a big difference. Here is uh, high income Asia Pacific, that is Japan and South Korea. And you can see that this is North America, that is United States and Canada, and compare with the South Asia. At least for the deaths due to the lung cancer, there is 20 years different. In, in, in fact, people with the lung cancer die 20 years sooner, regardless of the rate that is higher, they die sooner. Then we introduce the new idea. Okay, look to the mean age also. That shows that people, when they die. Okay, and we also introduce one other thing that I will talk more about, that is probability of the deaths between 0 to 70. Not for the all causes, just by causes. When we are saying what is the probability of the deaths for the ischemic heart disease between 0 to 70, that 70Q, 70Q0, that means that if people didn't die with the other causes, what is the probability of the deaths with the ischemic heart disease, with the stroke, with the lower respiratory. You can see overall in the world, these are decreasing. You can see. This is fortunately is decreasing, except of the breast cancer, except of the diabetes that is increasing, COPD, and cervical cancer and lung cancer. Probability of the deaths for the many causes is decreasing. For the some causes, mostly cancer is increasing. That it shows that uh, importance of the screening. And now we wanted to show to you that, okay, in which super region we had this fortunate event that uh, probability of the deaths decreasing and mean age increasing. Everything that is in the green, it means that both is increasing. Everything in this color that is dirty green, you can see that not only probability of the deaths increased, 70Q0, also mean age decreased. Okay, in South Asia, in sub-Saharan Africa, you can see not only probability of deaths due to the ischemic stroke, to the ischemic heart disease and to the stroke is increased, mean age decreased, and same as this for the breast cancer. For the Central Europe and Eastern Europe and Central Asia, HIV/AIDS, because we compared 2000 with the 23, that HIV/AIDS is increasing, but diabetes, if you look, almost situation in the whole world is very bad, except of the high income. And in the high income, COPD has a problem, same as sub-Saharan Africa. This is a little big table. I just wanted to show to you, because I understand we made this table, and understanding of this table is a little hard. Then I tried to explain here this table, maybe help you for the when you look to the paper, you understand much better than this. This is a combination of the probability of the deaths and mean age. Okay, and this was for female, this is for male, and uh, it has same pattern. You can go through that and you look to that. In the male high income, uh, there is no any risk for high income, except of the when you go to the paper, you will see that there is some problem in the drug use overdoses and violence that in the high income is increasing. Now we are in the violence. And this is something that there was not in the paper, but I will be happy to explain this here. Okay, look, this is the number of the deaths by suicide. Every year, around 800,000 people die by suicide. And this number from 1990 didn't change. And 400,000 die by homicide. And this number didn't change. And this is very unfortunate. And this red is by the war. And you can see it's increasing and it stay in the higher level. And this green is by the natural disaster, a storm, earthquake, tsunami. And this is the Polish conflict. Okay, you can see that regardless of the problem of the war we have in the world, we have a big increasing, a big number of the deaths in the homicide and suicide. And this number is stable in the world by the time. It didn't change. Okay, now it's good we go to the North Africa and Middle East and see, okay, how is the situation? Unfortunately, we are seeing that war is increasing. This is Syria war, this is Arab war, and this is the recent war in Gaza that, okay, is much higher than suicide and homicide. And again, this is unfortunate situation that we have. One other thing, then I will go to the GBD compare. If you see that fraction of the VLL or number of the VLL is going down, that is very good. But when VLL is going down, VLD increase, because this is the job of the health system. Okay, don't let people die. Maybe in this process, you should make them for the something disabled. Okay, look, we move from the 500 million to the 900 for YLD, and from 2 billion from 1.8 billion. And you can see again that it's happened in every region. But unfortunately, in the sub-Saharan Africa, in the South Asia, this decreasing is not a lot, same as high income, same as Europe. Then again, we have this problem. Then if you let me go to the GBD compare and show something to you, I hope that it's work. Okay, here, this is the, let me make it a little bigger that all of the friends can see much better.
Mohsen, I think we could
Oh,
only
you
still see
lost?
your screen.
Yes, yes. Sorry. I I will add. Uh, okay. Okay. Now, do you have that?
Yeah, now it's GBD compare.
Okay, perfect. Okay. This is the new part that we added, and we want to stay on this addition part, that it is, we try to show probability of the deaths by the different causes if people didn't die with the other causes. This is probability of the deaths uh, for the age, uh, let me go to the, yes, 70Q0, comparing the world. And you can see that a stroke and ischemic heart disease increased, probability of the deaths due to the neonatal decreased, and diarrhea decreased, and then other thing that is increased is diabetes. And HIV, if you change from, for example, this to the 2005 or 6, you will see that after that, HIV decreased, and pattern, it will be same. If you change this to the, for example, 2020, you will see COVID goes up, and 2022, 2021, okay, COVID is in the top. And this is for the many other probability. For example, uh, 1Q0, probability of the deaths between 1, 0 to 1. Okay, you can see neonatal, congenital is going up, lower respiratory is going down, and then let me go to the 2023 and 2019, and you can see. And then also 5Q0, that everybody, many person love this age group because it shows the situation of the development. And you can see that again, uh, neonatal, lower respiratory, but diarrhea is going down. That I said congenital is going up, malaria is going down. If you change 2020 to 2019, I don't think that malaria going up a lot, because during the time of COVID, we lost uh, monitoring of the malaria in many countries, and there was increasing of the deaths, and we have many different uh, grouping of the age. For example, one other thing that I prefer to show to you, 25Q50. It means that between uh, age of 25 and 50, what is the causes of deaths? What is the probability of the deaths? Ischemic heart disease, stroke, COPD, lung cancer, diabetes is mostly causes. And for example, 15 to 35, oh, road injury, HIV, self-harm, interpersonal violence is going up. Maybe let's go outside from this discussion and go to the other part. Okay, this is again probability of the deaths, distribution of the probability of the deaths. 70Q0, you can see it is very bad, especially in the south of the world. This is that you can see, unfortunately. And this is male, female. This is male. Male in Russia, it is old. In the Central Asia, it is an old history. If you change the time, maybe it will be different, no difference. But anyway, this is same as past. You can find rate of the percent change. That is same as this we have in the uh, GBD compare. One other thing that in the GBD compare is new and you should look is life expectancy. It is a little slow because it has to bring a lot of data. I am sorry, 1 second. Okay. Okay. Let me explain a little this because many person ask about that. 1 second. This part is slow, and if you are working from the country, you should know that this is the problem in the running of the data. And here, let's select one country or select global. Okay, 1 second. Okay. This uh, black line shows life expectancy in the global in the 1990, 62.8.2. And this one shows life expectancy in the 2023. Here you have different causes that with the decreasing helped to increasing of the life expectancy. And here different causes that had effect in the not increasing in the life expectancy. If you click on that, it will give you a table. That this table, again, this is a little slow. This table give you which disease was cause of decreasing for the life expectancy and which was cause of increasing for the life expectancy. If you remember in the paper of the 2021, we explained this very well. But here you can see, with the decreasing of the diarrhea, that was a very important human work in the global level. We decreased the area 1.2, stroke 1.2 year. With the decreasing of diarrhea, we increased life expectancy 1.2 years. That is very important. Stroke around 1 year, neonatal disorder 1 year, and then go to the down, and this is the causes that with the decreasing, we increasing the life expectancy, and this is the causes that with the increasing decrease the life expectancy. Just I wanted to explain these two things. I think that I talked a lot. Maybe we have to go through the question. If there is any question, I will be very happy to answer. And okay.
Thank you so much, Mohsen, for the excellent presentations, and thank you to those of you who've already put questions in the Q&A box. Please keep adding them. And so we do have several questions, and I can start with the first one. What would you identify as the three most significant findings from GBD 2023 regarding mortality trends and causes?
We are working in the causes of this. Then we can talk about just causes of this. The most important thing that we find is, okay, we lost 18 million people in the COVID, that they should not die in these 3 years. And this is the human failure. We were not ready. We didn't approach very well pandemic, and then we lost 18 million population. For sure, they were father, mother, brother, sister of the many people. This is very important. And also we discussed about the probability. We bring this new idea that we can look. We discussed about the mean age, and we showed that one other important indicator in the GBD that we can compare, and also you can do that. It's not very complicated. We explained in the paper the method that we did, and you can do that for your country. That is one other. We mostly produce the method and information. Information is in the GBD content, except of the COVID and there are many discussions. For example, in the high-income country, in the Latin America and North America, some causes is increasing. That is homicide. That is drug use overdoses. And this is important. Young age are more at risk compared with the past for the dying due to the different causes. That most important is homicide, suicide, drug use overdoses. These are the important findings. But anyway, there are a lot of findings. Anybody depend to the her field, look to the different causes. Thank you.
Thank you so much, Mohsen. Next question is, were there any unexpected or sort of outlier results in the causes of death estimates, and how did you account for them?
Yes, unexpected was increasing of the deaths in the young ages, especially in the developed country. Risk of the deaths for the young ages in the developed country is increasing compared with the past. And this is in the table 1, I think, if I remember correctly, in the paper that you can look. If you want, I can bring the paper and show to you. But anyway, we showed that for the 2-3 things, it is very important. For the violence, for the drug use overdoses, for the suicide, in some region, there is some increasing that we have to pay attention to that. And also, okay, about the COVID, and most important thing that we show, it is comparison of the mean age between developing country with the developed country, regardless of the rate. People die much younger than in the developing country with the developed country. And this is additional thing compared with the higher rate. Thank you.
Thank you so much, Mohsen. We also have some questions in the Q&A box. Someone is asking, Muhammad Alu is asking, I would like to ask about the cause of urinary infection and male infertility. Why did you include male infertility with urinary infection?
Sorry, this is the naming, wrong naming. It is urinary infections and urinary disease. Male infertility, just they wanted to say that male infertility is here. This is wrong naming. We will fix that. Thank you. Thank you.
Yeah, thank you, Mohsen. And then another question about mental disorders. Is there any are there any advancements in terms of looking at mental disorders as causes of death?
Okay, that is a very important question. In the GBD, not unfortunately, fortunately, we do not calculate direct cause for the mental disorder. For example, depression, nobody died due to the depression, but people with the depression commit suicide. People with the schizophrenia commit suicide, commit homicide, and they have road traffic accident. We didn't calculate these based on the underlying cause. We calculate based on the increasing of the risk of homicide in the in the mental disorder. If you want, 1 year ago, we published a paper in the Lancet Psychiatry regarding of the how people with the mental disorder die in Brazil. That is a good paper. And it shows that in Brazil, in Latin America, highest rate of the people with the mental disorder die with the homicide, suicide, drug use disorder. These are the most important causes of death for them. Alcohol, road traffic accident. And now we are working in the other country, especially in the Scandinavian country, that pattern is different. We hope that we can publish this soon. Then you can read and you can have a good benefit. Anyway.
Great, thank you, Mohsen. Another question is, which preventive measures could have the greatest impact from your perspective on reducing premature deaths among young populations?
Diarrhea. That is clear answer that diarrhea is the most important causes that human you can maybe I remember. I can say that you cannot remember. When I was in the medical school, in the summer and the spring, all the hospital was full of the children with diarrhea. And now, fortunately, there is no, because there is a much lower, because we had an improvement in the water and sanitation. We had very good improvement in the prevention and treatment of the diarrhea, especially for the rotavirus vaccine. That is very good. And oral rehydration therapy, that it was very good. We did three important work. I hope that we did different and other important causes of this, we have this good success.
Great, thank you, Mohsen. And another question is, what are the differences between unintentional injuries, and why is it between unintentional injuries and transport injuries? Why are they separate?
You are completely correct. Transport injury is unintentional, but if we put transport injury in the under the unintentional, it is your correct point. We decreased unintentional to the we decreased road traffic as accident, transport accident to the level 3 causes, and then importance of these cause decreased. We keep these in the level 2 because we wanted to show importance of the road traffic accident. You are correct. There is no difference. Just for the keeping of the importance, we put this in the separate in the causes. Okay.
Thank you so much, Mohsen. We have a couple more questions.
Yes.
Given the current findings, what could be the most important actions for regions like low-income countries, Sahel regions in Africa, in terms of addressing their causes of death?
Okay, this is a hardest question. I cannot answer for all the country, but if you want to talk about the Africa, I can say that first, following Africa CDC, we are working with the Africa Union, especially Africa CDC, and Africa CDC is very eager to improve 2, 3 things. First thing is having a better vaccination and increase the coverage of the vaccination. That is a very important. Increasing of the efficiency and efficacy of the health system that we have in the different countries of Africa, and improvement of the risk factor, environmental risk factor, same as water and sanitation, and decreasing of the violence. In Western Sub-Saharan Africa, in Southern Sub-Saharan Africa, we have a big number of the violence. Then we have to decrease that. Fortunately, we don't have big violence in the eastern part, but we have a big violence in Sudan, in North Africa. And then, anyway, different problem in the different location.
Thank you, Mohsen. Next question is, I think this is relevant to the subnational data that we have. How is global information relevant for subnational policy making? How do you interpret or translate for local purposes?
I think that subnational estimation is very good for the policymaker. It's very good for the health system. We have many different examples from the different countries that they are using, so they are doing subnational estimation, and policymaker, health system is using this result. Look to the Ethiopia, look to the Philippines, look to the Italy, look to the many different countries that they use that. And also when they use the data, result of GBD, they are happy to more involve in the GBD, passing the data and other.
I think we have enough time for one more question. And so the last question for today is, the collaborator is wondering whether there has been any plan to include occupational status in the population that we have in the GBD, such as populations of students, retirees, unemployed, or in other specific occupational groups.
We do not have good information about that for the many countries. Then we cannot, but good news is that for the next iteration of the GBD, we will include illiteracy as a one other risk factor, and education as a one other preventive factor. But we have occupational health, but anyway, including occupation as a one other thing, one indicator for the causes of this, for the mortality, morbidity, is not easy because we do not have a good information in the different countries.
Great. Thank you so much, Mohsen. And we apologize if we didn't get to your questions, but if you have any follow-up questions, or if we have not answered your questions, please feel free to email us the questions to the GBD Secretariat account at gbdsec@uw.edu. And we also would like to remind you, if you haven't signed up for the other GBD in Focus sessions, these are the upcoming sessions. Again, this is the causes of death is the second session that we have in the series. Please register if you are interested in delving deeper into the findings from the GBD 2023 study. And thank you so much, Dr. Naghavi, for your excellent presentation, for your time in this session. A lot of emojis of clapping and hearts flying across the screen. So I think people have enjoyed it. And thank you so much also to all of our collaborators who are joining today for your active participation and great questions. And GBD would not be possible without the collaborator network, the work that everyone does together that we do together goes a long way towards clarifying the nature of health challenges we face as a global community. And our discussions, like the one that we have today, assist with identifying possible solutions to those challenges. So we really would like to thank you for everything that you do and for your valuable collaboration with us. Once the GBD 2023 In Focus series has concluded, we will share a recording on the collaborator portal. And again, if we didn't get to your question today, please send it to us at gbdsec@uw.edu, and we will look at it and answer your question one-on-one. So thank you again, everyone, for being here, and we'll look forward to seeing you at future webinars. And I wish everyone a wonderful rest of your day or a great evening. All right. Thank you, everyone. Thank you, Mohsen.
Thank you. Bye.
Okay, I think we can start now. It's 7 a.m. in Seattle.